Social, relational and cultural activities, creative and art-based activities, rituals and celebrations, sport and play, and informal education and informal learning are central to a psychosocial program and to the community-based models of work we are referring to in this course. If we look at the model of psychosocial approach, we can see how these activities are all acting exactly at the center of the interrelation or biopsychological, social, relational, and cultural spheres. Let's take the example of arts-based activities or creative activities like dance, music and drama, or sport and play activities. They all link body and mind, the biopsychological level, in a creative or agonist action that is relational, the social relational level, rooted in a culture, and creates, in the case of artistic activities, cultural objects such as songs, sculptures, paintings, plays, videos, but also narratives, and this is the cultural aspect. If we look at the model of psychosocial programming, we see how these activities allow the individual experience of suffering, giving to this experience containment in metaphoric, artistic, ritual and bodily forms. They link also the individual experience with that of a group, and all work on social communication directed to the entire community. In addition, these activities, while recognizing and allowing safe expression and elaboration of suffering, really focus on resilience and agencies, and in engagements that traditionally mitigate distress, either directly or by acting on factors that have an impact on it, like social cohesion, agency, and social networks. They also give evidence to the positive outcomes of the emergencies, in terms of skills, creativity, and reflection. Community support activities have a significant impact on psychosocial well-being. This is because they can help bridge tradition with the necessity to change, re-elaborate what individuals and communities face after a crisis, and help them maintain a sense of identity. To illustrate this further, let us look together at an animation.
Culture and its expressions impact how mental health and psychosocial support, MHPSS, support individuals and communities in maintaining a sense of self, belonging, and positive social relations in the midst of crises. This video will highlight ways MHPSS programs can facilitate and support socio-relational and cultural activities, creative and art-based activities, and rituals and celebrations. Socio-relational and cultural activities support communities' resilience by providing spaces to engage in cultural practices, strengthen social relations, and maintain a sense of identity and belonging. MHPSS programs should support spontaneous activities embedded in a culture and facilitate the creation of groups where appropriate. These groups can take the form of interest groups, activity groups, problem-based groups, traditional groups, and structured groups. In order to support socio-relational and cultural activities, an MHPSS manager should understand the traditional ways of gathering in a community, identify what kind of support may be needed to reactivate or maintain these groups, identify the value these groups and ways of gathering can have for the objectives of the programme, identify a community facilitator for the group and provide them with training in peer support and mentoring techniques, and create a network between relatable groups through exchanges and events. Creative and art-based activities exist in any community and are rooted in people's agency. These activities can take the form of music, theatre and drama, storytelling, poetry and creative writing, dance, painting, sculpting, photography, and video making. These activities can facilitate expression and relaxation, the processing of emotions, thoughts, and feelings in safe ways, and the transformation of personal and collective narratives around painful life events. They can also promote agency, problem-solving, and relationship building. An MHPSS program can protect and reactivate creative and art-based practices after a crisis through 3 different processes. Community-generated activities, which protect, support, and reactivate existing creative and art-based resources in a community, and can take the form of supporting theatre ensembles, dance and music groups, or individual artists continuing the production of their artistic creations. Program-facilitated activities, which can take the form of creating or supporting spaces such as festivals, events, contests, art exhibitions on a given theme, and dedicated multidisciplinary spaces. Program-generated activities, which have a specific psychosocial support goal and aim, and target specific issues or groups of people. These activities can take the form of art therapy workshops or working with at-risk groups on a particular creative practice, and can have MHPSS objectives, such as promoting relaxation, self-esteem, social cohesion, community development, and peaceful discussions. Lastly, we will discuss the importance of rituals and celebrations in supporting the mental health and psychosocial well-being of crisis-affected individuals and communities. Rituals and celebrations are context-specific and can take many different forms. As rituals and celebrations are learned and repeated for generations, they help to contextualize current situations within history and heritage, providing continuity and perspective. They allow people to communicate negative experiences in safer, indirect ways, and can provide spaces of reflection. Rituals can also represent, validate, and accompany transformations, and in situations of emergencies and displacement, can ritualize experiences of violence, displacement, and relocation, and celebrate the resilience of communities. For more information, please visit chapters 5 to 7 in the IOM Manual on community-based mental health and psychosocial support in emergencies and displacement.
You just saw an animation which focuses on social, relational and cultural activities, art-based and creative activities, and rituals and celebrations. But most of what is said can be expanded certainly to play, in many aspects to sport, and to an extent to informal education and learning. I believe that it's clear from the animation how these activities all focus on a sense of community and belonging, and the culture that informs this system, giving individuals a sense of safety, continuity, belonging and purpose, without which psychosocial well-being, as we know, is hardly attainable. However, civil wars and natural disaster, displacement and disruptive events do not have effects only on the individual psyche, but they also transform and wound the wider system, the social and symbolic fabric of the community. And they leave behind wounded social relations, gaps in cultural activism and agency, lack of basic services, disrupting the sense of safety and belonging that these elements usually produce. These collective wounds to the wider social systems are as important as the individual psychological suffering, and in fact very often they are one of the main determinants of this suffering. To conclude, if we believe that strengthening resilience is a crucial factor in the recovery from adversity, if we believe that adversity affects communities and groups as much as it affects individuals, if we believe that the psychological difficulties of individuals often arise from the disruption of the protection the community and other social systems provide, and finally, if we believe that culture is in this sense a fundamental element of what brings community together, then it becomes all too obvious that strengthening collective resilience through cultural and relational programs is a fundamental component of a community-based MHPSS program. Community activities community support activities therefore, might protect, restore and transform within the process of a psychosocial recovery. The protective factors can be summarized when in the immediate aftermath of crisis, community-based psychosocial activities often offer occasions for collective expression of loss, fear, pain, grief, guilt, anger, disorientation. For instance, participation in religious rituals and public celebration can help individuals break isolation, transcending personal fears and suffering. Restorative factors. After arriving in camps or host communities, individuals might still live in denial, unable to face the unacceptable, experiencing social withdrawal and also discrimination. Participation in sport practices and cultural events and social theatre help people reconnect with each other and with the host community, giving meaning to the experience they faced. Transformative factors. Rituals and the cultural production of creative and arts-based activities can create new narratives and new cultural objects, a new culture in the context. You will see in more detail the rational, psychosocial value and programmatic aspects of each of these activities in the dedicated sections. In this general introduction, I conclude with some programmatic categorization and definitions that are common to all these activities and might help us in better navigating the single components, the single modules dedicated to the various activities. We categorize community support activities in our MHPSS programs in community-generated activities. MHPSS programs, in this case, identify and actively engage with local cultural, social, artistic, sport, informal education groups and activists and religious leaders to protect and support activities that these groups are still organizing, as well as reactivated activities that these groups and communities were used to organize, could have a positive effect in the present, but are currently on hold for logistical, security or other circumstances. By instance, I make just a very simple example, we support the pre-existing community choir and band, providing them a safe place where to meet and the instruments they miss after the crisis. Program-facilitated activities are related when MHPSS programs build on existing social relational practices, creative and art-based, cultural, play and sport activities, to strengthen the impact of these initiatives on the affected population, facilitating networking between them or giving them specific psychosocial objectives, therefore capacitating the activists involved in them to this effect. By instance, again the same example, we will train the choir leader in psychological first aid or support group skills. We will ask the band members to give music classes to youth and organize a choir festival to mix the displaced community and the host community choirs. Program-generated activities happen when MHPSS programs offer activities of the kind with specific aims based on identified needs in the community. By instance, building on the fact that choirs are culturally validated and popular activities in those communities, we will offer a music workshop to distressed women using elements of music therapy. The same activities can be also divided in structured and unstructured. An unstructured activity, by instance, is when youth gather to play football or volleyball by themselves at certain hours of the day in a certain place. Structured activity are instead a football league and or a football course. MHPSS managers are not supposed to be expert in art-based, sociocultural play and sport, ritual and educational activities. However, all these activities should have some methodological elements in common. I summarize them as follows. They have to be graduality driven, they have to have a gradual approach. There is no rush towards a product or an outcome, but time is allowed for individual expression, relationship building, establishment of safe spaces, trust building, exploration and innovation. They are all resource-based activities. Psychosocial interventions in emergency rely on existing resources and capabilities in this case. People may be grouped based on needs of interest, but the group focuses activities on its own resources and reactions to adversity. They are agency-based activities. Community support activities are neither top-down nor didactic, but they are always co-facilitated with participants or facilitated by participants. Participant ownership is both a condition and an objective of these activities. They are diversity-focused. Each individual should be able to express his or her own personal and cultural identity. Socialization of differences is encouraged by the fact that diversity among participants leads to better creative outcomes. Think again about the choir or a music group. Group building. Participants are stimulated through sport exercises, collective games, artistic workshops to cooperate, to support each other and to communicate without using language, which, especially in conflict-torn situations, can be very divisive. And linked with this, all these activities are metaphor-based. Not all, maybe, most, because they engage theater, visual arts and music, which are metaphorical languages in nature. Evocative languages and transitional objects and practices, such as a song, a character, a puppet or a ritual, allow for protected expression of personal issues, because you are projecting your individual experience on an object that is not you, even though might allow you to express yourself. Two last caveats to conclude. In the Interagency Standing Committee pyramid of MHPSS, these activities feature mainly at level 2, the one of family and community support, and in fact are called community support activities. As we will see in the various sub-modules on the components, each of them can be actually used at different levels of intervention. But mostly, at least in IM programs, will be used at this level, the second. There is a tendency to confound community-based psychosocial activities with community support activities. By contrary, a community-based approach should inform all activities in a mental health and psychosocial support program, from including social consideration in the provision of care to the provision of care for people with severe mental disorder. Even more so, it should characterize this activity, which aim at healing the community fabric as much as the individual feelings. Finally, when engaging vulnerable categories in these activities, it is important to adopt specific safeguards. For children, for instance, you can look at the document appearing now on screen. For other populations, see the chapter 5 to 9 and 12 of the manual.